Hi, my name is whintz. I'm a NAU graduate nursing education student with National American University. I am here to discuss my nursing capstone project. So moving right along and into the project, here's my problem statement. I'm working on, and what I'd like to work on is to evaluate the education that's being presented from the learner's perspective versus just the educator's perspective. And what I'm trying to do is kind of change the whole paradigm as far as how education is evaluated. And it should come from the student versus the educator, because ultimately the student's the one who will benefit from the learning. So here's my literature review. The first study demonstrates the importance of improving teaching performance from educators. The second study discusses the importance of learning needs among educators as well. And the third study focused on students' perception of the quality of the education that they received. The fourth one reviews interviews following simulated clinical experience. So the PARSH in 2010 actually discussed how students felt after a clinical experience through the use of simulation. And the final one discusses changes in attitudes among students that professionals, educational professionals, are failing our students by failing to understand the importance of giving them negative grades or negative feedback as far as how we educate our staff. So that's one of the things that study focuses on. So part of the internal review board, this proposed project will focus on the effectiveness of clinical educator through post-educational briefing. The study will include randomized surveys to avoid any respondent being subjected to ridicule or bias related to the response of perceived bias from the clinical advisor or other peers. A thorough review of all materials prior to dissemination to the learners will be conducted, and at this time there is no concern for risk to humans or potential for bias, so no IRB would be required at this time, subject to faculty approval. So theoretical framework, one of the things I chose is the Orm's self-care deficit theory, and the reason why I chose that is all these statements are equally important in nursing education as well as direct patient care. So people should be self-reliant, responsible, as well as others in the family who need care. People are distinct individuals, and that falls right along the path of educating our students. Nursing is a form of action. It is an interaction between two or more people. In this case, your clinical advisor usually has interaction with 5 or greater students. Successfully meeting universal and development self-care requisites is an important component of primary care prevention and ill health. It's important as students and educators to take care of ourselves so we can take care of our patients and our students. A person's knowledge of potential health problems is needed for promoting self-care behaviors, and self-care and dependent care are behaviors learned within a social, cultural context. So some of the methodology behind my capstone project. The method will be implemented into clinical portion on capstone proposal. We'll use direct observation of nursing students and consists both of quantitative and qualitative data. Direct observation of nursing students' abilities will be conducted by and through monitoring of the student's ability during the clinical experience. The students will be asked to complete a simple questionnaire, which you can see here under the clinical faculty evaluation form. We'll be asked to complete this following the clinical setting. While the questionnaires will yield potential specific scientific results, direct observation of the student's skills will yield additional valuable information. Once these clinical evaluation forms are filled out, they will be recorded, documented, and then destroyed at the site. And so for evaluation of the nursing educator, all surveys will be evaluated. All subjective and objective data will be documented and mentioned in the final capstone project. Any feedback from any staff members and or the preceptor will also be reviewed for inclusion in the final study. All patient data will be excluded from the final report. However, if there are pertinent information that applies to either the nursing educator or the students, this will be included or at least reviewed for inclusion in the final paper. Evaluation of the nursing educator will be completed through the observation tool, as you can see to your right, and destroyed upon recording of data. And once again, thank you for taking your time out of your busy days and your busy schedules, especially during the holidays, to review this video. I thank you very much. And here are my references.